There's a silent thief that can creep into your life without warning. It doesn't make much noise at first, but slowly, quietly, it steals your strength, your independence, and even your joy. That thief is kidney disease. Many people over 50 are surprised to learn how vulnerable the kidneys really are and how much they shape the quality of our daily lives. Your kidneys are no larger than a fist, yet they carry out an enormous workload, filtering blood, balancing fluids, regulating blood pressure, and producing hormones that keep you alive. When they begin to weaken, the change is often invisible until suddenly you're facing swelling, fatigue, high creatinine levels, or even the frightening reality of dialysis. But the truth is, you have more power than you realize to protect kidney health. I'm Dr. Brian, and welcome to Channel Vital Science for Seniors. I want to begin with something many people overlook, the way our minds and emotions directly affect the health of our kidneys. I remember a patient named Evelyn, a retired school teacher in her early 70s. She came to see me after being told her creatinine levels were creeping up. On paper, her blood pressure and sugars were only moderately elevated, but when we sat down to talk, it became clear she was carrying a weight far heavier than her lab results. Chronic stress, worry about her children, and the grief of losing her husband just 2 years earlier. Her body was showing the toll of her spirit's burden. This is not unusual. Stress and anxiety act like invisible accelerants, pouring fuel onto the fire of high blood pressure and diabetes, the very conditions that most often lead to kidney damage. It's as though the mind whispers orders to the body, and the kidneys quietly obey. When we are constantly in a state of worry, the body releases stress hormones that tighten blood vessels, raise pressure, and trigger inflammation. Imagine trying to water your garden through a hose that someone is squeezing tightly. It becomes harder and harder for water to flow. That is exactly what's happening inside your kidneys when stress constricts your blood vessels. Over time, that pressure damages the delicate filters, called nephrons, and the result is rising creatinine, swelling, or fatigue. Evelyn thought stress was just a mental burden. Once she understood it was also a kidney burden, she became open to change. That change doesn't have to mean reinventing yourself. It can be as simple as carving out a daily ritual that lowers the tide of stress. Some of my patients practice 5 minutes of slow breathing before bed, inhaling deeply through the nose, exhaling gently through the mouth. Others turn to gentle movement, like Tai Chi or walking with a friend. The goal isn't perfection, it's interruption. By interrupting the cycle of stress, even briefly, you give your kidneys a break from the storm. And with each day you do this, you're building resilience, not just in the mind, but in the filters of your body. But stress isn't the only hidden culprit. Many of the foods we reach for in moments of convenience, boxed dinners, frozen meals, a quick sandwich from the deli, carry staggering amounts of hidden salt and sugar. Salt drives up blood pressure, while excess sugar feeds obesity and diabetes. Both are like villains working hand in hand against your kidneys. I once explained to a patient that every extra teaspoon of salt is like placing a heavy backpack on his kidneys. He laughed, but a month later told me he now pictured his kidneys trudging along under that backpack whenever he picked up a bag of salty chips. That image alone helped him put the chips back on the shelf. The solution isn't to feel deprived. Instead, think of flavor as something to be rediscovered. Herbs, spices, lemon zest, and garlic can bring life to a meal without harming your kidneys. And when you choose whole, nutrient-rich foods, fresh fruits, colorful vegetables, lean proteins, you're giving your kidneys what they crave. Balance, not burden. Over time, this becomes not just a diet, but a form of kindness to yourself. Another hidden danger comes from the very medicines many people trust. Over-the-counter pain relievers like ibuprofen or naproxen, when used regularly, can silently choke off blood supply to the kidneys. It's like shutting the faucet on a delicate fountain. Occasionally for a headache is usually safe, but daily or long-term use can spell trouble, especially if kidney function is already fragile. Evelyn admitted she had been taking pain relievers almost every day for arthritis. Once she reduced them with safer alternatives suggested by her rheumatologist, her kidney function stabilized. The lesson here is not to fear medicine, but to respect it and use it with guidance. And finally, let's talk about supplements and herbal remedies. I meet many people who believe that if it's natural, it must be harmless. But nature has a double edge. Some herbs raise potassium to dangerous levels, others can strain kidney function or clash with prescription drugs. I once had a gentleman in his late 60s who proudly showed me his kitchen cabinet filled with bottles of powders, teas, and capsules. His kidneys, however, were not so proud. They were struggling to keep up with this chemical cocktail. After we trimmed down his list with care, his lab numbers improved, and he admitted he felt lighter, both physically and mentally. The message of this first part is simple. Your kidneys are not just filters, they are partners in your entire way of living. Your stress, your food choices, your pain remedies, and your supplements all flow through them like a river through a dam. Every choice you make is either clear water or heavy debris, and you have more power than you realize to decide what passes through. If the first part was about the mind and lifestyle, this part is about the fuel you place into your body, the food and drink that either strengthens or weakens the kidneys. I like to think of the kidneys as a pair of diligent housekeepers. Every day, without complaint, they sift through gallons of blood, pulling out waste and excess fluid. But like any housekeeper, if you track too much dirt inside, eventually they become overwhelmed. What we eat and drink is the dirt, or the polish, that determines how hard our kidneys have to work. One of the most important things is sodium. Most people don't realize just how much salt is hidden in everyday foods. It isn't just the salt shaker at the dinner table. It's the canned soups, the frozen dinners, the salad dressings, the sliced deli meats, even the breakfast cereals. All of these contain sodium that quietly builds up. Too much sodium raises blood pressure, which acts like a hammer pounding on the fragile vessels in the kidneys. I often tell patients to imagine their kidneys as a sponge. When blood pressure is high, it's like pressing that sponge down with a heavy brick, over and over, day after day. Eventually, the sponge can't spring back. But when you reduce sodium, you take the brick away, and the sponge has a chance to work freely again. Now, it isn't just sodium. Potassium and phosphorus also play a role. In a healthy body, the kidneys keep these minerals in balance. But when the kidneys weaken, potassium can build up, leading to dangerous heart rhythms, while phosphorus can accumulate, weakening bones and harming blood vessels. That's why you might have heard of low potassium foods or diet for kidney disease. These aren't trendy buzzwords, they're life-saving choices. Swapping a banana for a handful of blueberries or choosing rice instead of potatoes may seem small, but these changes reduce the strain on your kidneys. Let me share the story of Harold, a 68-year-old who came to me after his doctor told him his creatinine was rising. He loved orange juice with breakfast and potato chips at night. We sat together and restructured his meals. Berries instead of oranges, unsalted almonds instead of chips, and lots of water throughout the day. Within a few months, his creatinine stabilized, and more importantly, he felt more energetic. He told me he never thought such small shifts could have such a big impact. That's the power of food. It doesn't just fill you, it heals you. Hydration is another cornerstone. Think of water as the river that keeps waste moving. Without enough water, that river dries to a trickle, and minerals settle, forming kidney stones or infections. But when you stay hydrated, your kidneys are bathed in flow, making their job smoother. It doesn't always have to be 8 glasses a day for everyone. Your needs depend on your activity, climate, and health, but sipping water regularly through the day is like oiling a machine. It prevents the grinding wear and tear. And then there's something unexpected. Baking soda. Yes, the same white powder that sits in your pantry. Under medical supervision, sodium bicarbonate can actually help people with chronic kidney disease. Here's why. As kidneys weaken, acid begins to build in the body, leading to something called metabolic acidosis. It's like a slow corrosion that damages tissue and speeds kidney decline. Baking soda is alkaline, and in small doses, it can neutralize that acid. A study published in the Journal of the American Society of Nephrology found that patients with CKD who took sodium bicarbonate slowed the progression of kidney disease compared to those who did not. But here's the key. It must be guided by a doctor, because too much can tip the balance in the other direction. I once had a patient, Maria, who had advanced kidney disease. She was skeptical when I suggested a trial of carefully monitored sodium bicarbonate. But after a few months, her lab values improved and she felt less fatigued. She joked that something as humble as baking soda, the thing she used to scrub her sink, was now helping her body. It reminded her that healing often comes from simple, overlooked places. So when we talk about diet and natural remedies, we're not talking about giving up the joy of eating. We're talking about choosing foods and simple tools that lighten the kidney's load rather than burden them. A plate of colorful vegetables, lean fish, whole grains, and a tall glass of water is not punishment. It is protection. It is your way of telling your kidneys, I've got your back. And that message, sent meal after meal, day after day, adds up to years of preserved health and independence. Now let's step into the final and perhaps most empowering piece of the journey, the partnership between you, your doctor, and the choices you make moving forward. Kidneys do not fail overnight. Most often, decline is gradual, like a clock winding down in slow motion. The tragedy is that many people never realize what's happening until it is almost too late. But there is hope, because with regular care and monitoring, you can slow, sometimes even halt, that winding down. The first step is uncovering the root cause. Kidneys rarely suffer in isolation. They are part of a larger system, and most often the culprit is something upstream: diabetes, high blood pressure, recurring urinary infections, or inherited conditions like polycystic kidney disease. I think of the kidneys as a river's delta. If there's pollution upstream, the delta pays the price. That's why identifying what's happening higher up is essential. I remember a patient named Robert, a retired mechanic who loved to tinker in his garage. He came in frustrated, saying, "Doc, I'm always tired, my ankles are swelling, and my labs show high creatinine. What's going on?" After a series of tests, we discovered uncontrolled high blood pressure was the root cause of his kidney strain. For years, he had brushed off his blood pressure medications, thinking they weren't necessary because he felt fine. Once he understood that high pressure was like a wrench slowly crushing the pipes in his kidneys, he became committed to treatment. Within months, his blood pressure dropped, his swelling eased, and his kidney decline slowed. The lesson was clear: treat the cause, and you protect the kidneys. Screening plays a vital role as well. A simple blood test for creatinine and a urine test for protein can reveal early warning signs long before symptoms appear. It's a bit like checking the oil in your car. You may not notice anything wrong while driving, but the dipstick tells the truth. When we catch kidney issues early, we have room to act, to adjust diet, medication, or lifestyle before major damage sets in. In fact, research shows that regular kidney function monitoring in high-risk groups, those with diabetes, hypertension, or a family history, dramatically reduces the risk of end-stage kidney disease. Yet too often, people wait until they're swollen, fatigued, or nauseous, and by then, the kidneys are already severely compromised. I encourage every person over 50, especially those with diabetes or high blood pressure, to ask their doctor for these screenings at least once a year. It is not paranoia, it is prevention. Think of it as giving your kidneys a voice, allowing them to whisper concerns before they are forced to scream. But medical care isn't just about numbers. It's also about knowledge. Staying informed is one of the most powerful tools you have. Science is advancing every year. There are new medications that protect the kidneys while also reducing heart risk. There are experimental devices, even artificial kidney prototypes, on the horizon. By keeping yourself educated, by asking questions and engaging in your care, you ensure that you are not left behind as medicine moves forward. I often tell my patients, you are the captain of your ship, and we, your doctors, are the navigators. That means you have the right to understand your condition, the treatments available, and the choices before you. Patients who engage in this way often feel less fear and more control. They learn to see kidney disease not as a death sentence, but as a challenge to be managed. Take, for example, Linda, a 72-year-old grandmother who came to me devastated by her diagnosis of stage 3 chronic kidney disease. She believed her life was already written, that dialysis was inevitable. Together, we built a plan: a kidney-friendly diet, regular exercise, stress management, careful medication monitoring, and quarterly checkups. She joined a support group, learned how to read her lab results, and began asking informed questions at every visit. 3 years later, her disease has not progressed, and she is still living independently, gardening, and chasing after her grandchildren. Her story is one of empowerment, not despair. That is the heart of proactive care. It's about not waiting until you're forced into dialysis or transplant discussions, but stepping in now to change the trajectory. Every small act, monitoring blood sugar, lowering blood pressure, checking creatinine, choosing low potassium foods, or simply showing up for appointments, is like a brick laid in the foundation of a stronger future. Kidney health is not just about survival, it's about freedom. The freedom to travel, to cook, to laugh, to live without being tethered to a dialysis machine. By taking the reins, by combining lifestyle, diet, and medical partnership, you preserve not just your kidneys, but your independence and joy. And isn't that what life after 50 is all about? Not just adding years, but adding life to those years? So here we are, at the close of this journey together. I want you to remember that kidney disease is not the end of your story. It is simply a call to pay attention, to care for yourself in ways you may never have before. By calming stress, choosing foods that heal, and working with your doctors to uncover root causes and monitor progress, you are protecting more than just kidney function. You are preserving your freedom, your independence, and your joy. No matter your age, your body can still respond to kindness. Your kidneys are waiting for that gift.